Hello, all. I'm Dr. Aruna Muralidhar, a senior consultant, obstetrician, and gynecologist at Fortis Hospital, Richmond Road. So, today I would like to speak on a particular topic which is of very vital importance to all women, that is contraception. We, as a Fortis hospitals in Bangalore, initially were catering to women as Fortis La Femme, and now we've become a multi speciality hospital and are called Fortis Hospital Richmond Road. So, without any much further ado, I'd like to talk about contraception because this is one of the important ways of how a woman can plan her family. So when we talk about contraception, there's this general feeling that it is only the pills, only the birth control pills, and that is not true. Contraception includes barrier contraception, which are condoms, either male or female, natural methods of contraception, hormonal, which are the pills, or even intrauterine devices and implants. So let me just talk about a brief advantages and disadvantages of each of them. If you're a young girl just getting married or sexually active, you probably and want sort of a temporary measure, you probably are very well off using a dual control method, which is both condoms to prevent sexually transmitted infections and to a certain extent unwanted pregnancies, but also combine it with birth control pills so that you have the added advantage of not falling pregnant unexpectedly. And also, the condoms will prevent sexually transmitted infections, as I said. But this is for a short period of time, maybe up to 1 or 2 years. However, if you're looking for a longer term of contraception, probably worthwhile thinking about intrauterine devices or implants which are hormonal or copper releasing. If you're talking about hormonal, they work by releasing a very small amount of hormone within the womb, and the insertion itself is a very simple 5-minute procedure, doesn't need anesthesia. But once it's inside, you can forget about it and not worry about unwanted pregnancies. Again, you have the hormonal methods, which are will last for about 5 years. The copper containing intrauterine devices last for 3 years, 5 years, or even 10 years. Right? The general effectiveness of efficacy of these are pretty good. So with a copper releasing device, probably the chances of unexpected pregnancy is about 1 in 100. Whereas with the hormone releasing device, which is the Mirena, the common brand, it is less than 1 in 100. So you can rest assured that pregnancy will not worry you. Then you have implants, which are small rod-like sort of implants, which go and sit under your arm, under the skin. You won't even know that they're there. Again, release hormones slowly into the system and last for up to 3 years. And these are all very effective, very safe contraceptives that anybody can think about or even opt for. If somebody has just recently had a pregnancy and delivery, post delivery, again, you've got to be worried about possible pregnancy when you're lactating or breastfeeding, because ovulation is still taking place. You still have a chance of falling pregnant. So don't assume that just breastfeeding will protect you from a pregnancy. So please seek a consultation about that, right? Because what happens is the ovulation or the egg release may start as early as 21 days after delivery. So again, a post-delivery woman who's breastfeeding can choose pills which have only one kind of hormone, which is progesterone, and after 6 months can choose the estrogen progesterone combination, or go for something which is more long-acting, like the intrauterine devices, which are copper T or Mirena, as I mentioned earlier. Suppose, you've already completed your family and have had 2 or 3 children, and you think that you've completed your family, then you can think about permanent methods, which are laparoscopic sterilization for women or vasectomy for the man, right? And these are permanent procedures, which means that you're not likely to fall pregnant again. And vasectomy is an easier, simpler way of sterilization, which requires probably just local anesthesia, whereas a laparoscopic sterilization requires a general anesthesia, but it's mostly a daycare procedure. So with this, I'd like to say that contraception is a very important aspect of a woman's, life in terms of family planning, etc. And even after 45, up to the age of menopause, there's still a risk of pregnancy. So even sort of a slightly elderly lady of 40 plus years should think about contraception, because sometimes you might find yourself surprised by having a positive pregnancy test. So, with this, I would like to say that contraception is easily available. There's a contraceptive option, a basket of contraceptives which you can choose from. You can always make an appointment and visit us and discuss all the options. If you have any questions, please put them in the chat down below, and we will be more than happy to answer your questions. Thank you very much. Signing off, Dr. Aruna Muralidhar.